Imperforate Hymen at age 11. He was an 11-year-old premaniacal girl. The mother noticed from early childhood that the hymen was imperforate, but she now presented because the girl complained of lower abdominal pain. There were no development of secondary sexual characteristics. The hymen was imperforate. So after examining the girl, we counseled the patient or the mother on hymenectomy after telaki, but before symptoms develop. This is important because if symptoms of cryptomenorrhea develops, there is a high chance of retrograde menstruation, which could lead to endometriosis and impair hepatitis in future. Remember the Samson's theory of retrograde menstruation. We are aware that the sequence of pivotal development is highly predictable, from the first visible sign, which is thelaki, to the last, which is menarche. And between thelaki and menarche, it usually takes about 2 years. So this patient is yet to develop breast birth. So it suggests to us that this girl is likely to attain her menarche from 2 years or more from now. We know that menarche can be attained anytime between 8 and 13 years, but average is 12.5 years. This girl is 11 years now, but there is no development of telaki. But let's also not forget that there are so many factors that affect that, from genetics to nutrition to other health factors. So the basis for counseling this patient is that when the breast part develops, we expect that between a year or two, menarche will set in. And then we follow the patients up and do ultrasound scan to pick the earliest onset of cryptomenorrhea after development of telaki. So we counsel the patient to come back if there are any problems, or if there are no problems, let the patient come when the girl develops breast birth or significant breast development. So this is the video. Initially, of course, what I suspected was cryptomenorrhea, because here you have an 11-year-old presenting with abdominal pain, although it wasn't cyclical. And we know that menarche can set in between 8 to 13 years, although the average is 12.5 years. So I thought probably it was a case of cryptomenorrhea, but that was not the case. As you can see here, over distended bladder, transversation. Look at slight mucoscolation within the vagina, which is not significant. Look at the thin endometrium here, and the right ovary here, not this multicystic ovary here. Not polycystic morphology, but this is multicystic ovary because the stroma is not thick. And this is consistent with hypothalamic immaturity. And look at the left ovary here. Multicystic. So again, megacorpus insignificant. Look at the thin endometrial stripe. Multicystic ovary, right and left. So going sagittal. So now look at the right ovary, multicystic. This could explain the abdominal pain the girl complained about. So look at this, multicystic ovary, likely to be a cause of the pain in this young girl. See the images. slight mucocorpus, not the cervical corporal ratio. Normal measurement liters for this age, but look at length of the right over here up to 3. So this could explain the cause of the pain in this girl.